Good afternoon, everyone. Thank you for joining us for today's update. I will start, as usual, with an update on some of the key statistics in relation to COVID-19. And let me say that, as on the last two Wednesdays, this will have two parts today. An update on the usual daily figures, but also a summary of the key points from today's weekly publication from National Records of Scotland. Now, this inevitably means a bit more complexity, so please bear with me as I go through these statistics. Let me turn firstly to the daily figures. As at 9 o'clock this morning, there have been 9,038 positive cases confirmed. That is an increase of 366 from yesterday's figures. A total of 1,776 patients are currently in hospital with confirmed or suspected COVID-19. That is a decrease of 90 from yesterday, and a total of 155 people last night were in intensive care with confirmed or suspected cases of the virus, and that is a decrease of 11 on yesterday. And let me again say today that these figures for hospital admissions and admissions to intensive care are really encouraging, and they are a cause for optimism, still cautious optimism, but optimism nevertheless. In addition, as part of a package of new information that we are providing on our website from today, I'm able for the first time to give a figure for the number of COVID-19 patients who have been discharged from hospital. And indeed, that is information that some of you over the last few weeks have contacted me to ask that we provide. So I'm able to confirm today that since the 5th of March, a total of 1,813 patients who had tested positive for the virus have been able to leave hospital, and I wish all of them well. On a much sadder note, though, I also have to report today that in the last 24 hours, 77 deaths have been registered of patients who had confirmed positive through a test as having COVID-19, and that takes the total number of deaths in Scotland as of this morning under that measurement to 1,062. Now, I've spoken before about the different ways in which we record figures, but it might be helpful to very briefly recap on that. For our daily update figure, that's the one you've just heard me give, we report on deaths that have been registered where the individual who has died had been tested and confirmed as having COVID-19. These figures are the most accurate ones we're able to provide on a daily basis, but obviously they don't capture all deaths from the virus. So National Records of Scotland now produce a report each Wednesday which captures all deaths registered within a 7-day period ending on the preceding Sunday. And that includes not just those with a confirmed laboratory diagnosis of the virus, but also deaths which are presumed to be linked to COVID-19 and mentioned on a death certificate. The number of deaths covered under this reporting system is therefore larger than under the daily system when you compare the two figures according to the same date, but it is the comprehensive one. NRS published the third of its weekly reports today, just around half an hour ago. That covers the period up to Sunday, the 19th of April, which is 3 days ago. At that point, according to our daily figures, if I can remind you, 915 deaths had been registered of people who had tested positive for COVID-19. However, today's report shows that by Sunday, the total number of registered deaths linked to the virus, confirmed and presumed, was 1,616. 651 of these were registered in the 7 days up until Sunday, and that's an increase of 41 from the week before, when 610 COVID-19 deaths were registered. Now, these figures are extremely difficult to report on, and I know that they will be difficult for all of you to listen to. They are higher than any of us would ever want to think about. But this information is really important because it gives us as full a picture as possible of the toll that the virus is having and how and where it is progressing. There are two further points I want to highlight about today's report. The first is that it again provides a breakdown of deaths by age, sex, location and health board area. It shows that almost 3/4 of those who have died were aged over 75. However, it also shows that much younger people do sometimes die as a result of this virus, and I think that is an important reminder that all of us are potentially at risk, so it is therefore important for all of us to follow the guidance. The report also provides information about the location in which people died. So far, 56% of those who have died in hospital, 33%, 537 people in total, have died in care homes, and 10% have died at home or in some other setting. Now, we know that older people in care homes are particularly vulnerable to this virus, but we must match that increased vulnerability with enhanced protection. So I want to say a bit more today about the measures we have put in place to protect residents and staff in care homes. Clear guidance on isolation in care homes has been in place now for some time, and it is, of course, the duty of providers of care homes to make sure that guidance is followed. The Health Secretary set out yesterday additional steps that we are taking. NHS Directors of Public Health are taking enhanced clinical leadership for care homes. A national rapid action group has been established which will receive daily updates and ensure quick local action is taken to deal with any emerging issues. Testing for staff and residents is being expanded. As I set out here last week, all symptomatic residents of care homes will be tested. COVID-19 patients discharged from hospital should only be admitted or readmitted to a care home once they've had 2 negative tests. In addition, other new admissions to care homes should be tested and isolated for 14 days. But let me stress that this is in addition to, and it is not a substitute for, the clear isolation and social distancing measures the guidance sets out. We're also helping to recruit students and people who've previously worked in social care to work in the care sector as soon as possible. Nursing staff are also supporting care homes where that is needed. And we're increasing access to NHS personal protective equipment to care homes. For example, this week, and let me stress this is in addition to our other supply routes, we are delivering supplies of aprons, gloves and fluid-resistant surgical masks direct to care homes. In doing that, of course, we're giving priority to those with known outbreaks of the virus. Finally, the Scottish Government from today is making more information publicly available about how the virus is affecting care homes. The statistics that we will publish at 2 p.m. today include the total number of adult care homes that have reported a suspected COVID-19 case at any time. Secondly, the total number of suspected cases in care homes so far, and also the number of care homes that have current suspected cases. On this last point, I can tell you that the figure today will show that 384 care homes have a current outbreak. But let me be clear what that means. It means that these are care homes that have at least one resident who has exhibited symptoms of the virus in the last 14 days. Now, we must remember, difficult though this is, that it is not unusual for people to become sick in care homes. Residents are often frail and nearing the end of their lives. But that does not mean that we consider any of these cases to be inevitable or that we don't do everything we possibly can to prevent them. Older people in care homes require as much, if not more, support and protection as anyone else in our society. And we're working with care homes and other partners to provide that. In doing that, we are helped hugely by the expertise and dedication of those who work in the sector, who are doing a remarkable job in incredibly testing circumstances, and we are grateful to all of them. The second point I want to briefly cover about these statistics is that the overall number of deaths registered last week is again much higher than the average for the same week in previous years, something that seems to be reflected in other countries at this time. And while around 3/4 of that difference this week can be attributed directly to COVID-19, more than 200 deaths can't be explained in this way. The data that NRS publishes today provides some more exploration of that and indicates that some of the difference appears to be a result of more people dying of cancer and of dementia and Alzheimer's. However, clearly this is an issue that we need to do further work on to make sure that we understand it fully. Now, I focus on the statistics in these updates because they're important, and I've set out the reasons why they are important to us in understanding the spread of this virus and informing our decisions about the way forward, and we'll say more about the principles that will underpin that decision making tomorrow. But I want to emphasise again that these deaths are not just statistics. They are all people who were loved and cherished and who, for their family and friends, are irreplaceable. And we should never, ever forget that. Just as we shouldn't forget those left behind grieving for their lost loved ones. So my condolences are with all of them. The final point I want to acknowledge is that listening to numbers like this is really horrible. Reporting these numbers is really horrible, and it's certainly the most difficult experience I've had as First Minister. And I know listening to this might leave you with a feeling of powerlessness as well as an acute and deep feeling of sadness. But I want to stress again today that none of us are powerless. We all have some power against this virus. By following the rules, by staying at home, by self-isolating when we have symptoms, we are all making a difference. And I know it's hard to see progress when the numbers of deaths that we are reporting are so grim. But the other statistics I'm reporting on daily right now, particularly on hospital and intensive care admissions, do show that we are making progress. They are a source for optimism. And soon, I hope, a fall in the numbers of people dying will show that progress too. By complying with the lockdown, we are protecting ourselves and others, and we are saving lives. But even a very small easing up in that right now could send all of that progress very quickly into reverse. So please keep sticking with it. Stay at home except for essential purposes. When you do go out, stay 2 metres away from other people and don't meet up with people from other households. And remember to wash your hands thoroughly and regularly. By doing this, we are all helping, and we are helping to slow the spread of this virus. We are protecting the NHS, which has not been so far overwhelmed in the way we feared just a few weeks ago that it might be. And despite these figures that I'm reporting to you today, we are undoubtedly, all of us, helping to save lives. So thank you once again for all that you are doing. It is hugely appreciated, not just by me and by the government, but the collective community effort is appreciated, I know, by everyone. Thank you very much for bearing with me through what I know was a complicated update today with lots of different statistics. I'm going to hand over now to Dr. Gregor Smith, the Interim Chief Medical Officer, who will share some further information with you. And then today, the Cabinet Secretary for Health is with me today and will take part in the question and answer session. But in the interest of time today, after Dr. Smith has spoken, we'll get straight on with answering questions from journalists. Gregor.
Thank you, First Minister. So, as the First Minister has already said, the figures published today are not easy to report on. I want to express my own condolences to all those who are affected. Each one of them represents family and loved ones who have suffered loss and are grieving, and it strengthens our resolve to try to bring about new ways of treating COVID-19. We have a strong history of medical research in Scotland. And part of our COVID-19 response has been to rally our research community to advance understanding of COVID-19, to gather evidence about effective interventions and to understand the impact that COVID-19 is having on our population. As a new virus with no specific vaccines or treatments, advancing this scientific knowledge and researching new ways to understand and treat the disease is absolutely critical. This will be key to helping guide future decision-making and the treatment and care of our patients in Scotland. The Chief Scientist's Office of Scottish Government is leading this effort, supporting NHS boards across Scotland to take COVID-19 research, whilst also working in collaboration across the UK nations to identify studies which should be given the highest of priorities. There are 4 main research areas that we're concentrating on: identifying and testing ways to treat people with COVID-19, vaccine development, understanding how and why it affects people in particular ways, and disease surveillance, or how it transmits across groups of people. Scotland is actively participating in a single national UK process to prioritise this work, led by the National Institute of Health Research, to ensure that this is coordinated effectively. Before I outline some of this research, I want to take a moment to thank the research community across Scotland. The pace of work and commitment of teams across Scotland has been outstanding and is testament to the world-class research infrastructure and expertise we have here in Scotland. A special thank you must also go to the patients participating in these studies. We are hugely grateful to them and their families for their support. This activity is really essential to the future treatment of patients in the UK and around the world. As of today, Over 10 prioritised clinical studies are currently taking place in Scotland across primary care, hospital settings and intensive care units, with a further 4 in set-up phase. This is a rapidly moving area, with additional studies being reviewed and approved through the prioritisation process. To date, almost 800 patients have participated in these studies. To highlight just a couple, the recovery trial is testing if existing or new drugs can help patients hospitalised with confirmed COVID-19. The first 2 therapies to be tested are 2 HIV drugs, lopinavir and ritonavir, and low-dose corticosteroids. And the aim is to have this data available for decision-making from this research within a short period of 3 months. The genomic study is another important study which was already taking place, but which has now been tailored to look at COVID-19. This study is led by Dr. Kenny Bailey and his colleagues in Edinburgh, and looks at the genetics of susceptibility and mortality in critical care by comparing the DNA from patients who have been confirmed to have COVID-19 with samples from healthy people. While scientific knowledge about the virus is developing around the world and real collaboration and sharing of knowledge is evident, there's much about this virus we still don't know. Studying patients with COVID-19 and gathering information through the tests they undergo can advance our understanding and support possible future treatment options. I'm encouraged by the vast efforts underway, but also very aware of the huge practical challenges all health systems face when carrying out research at this time. So again, I want to acknowledge and thank the research community for the response to the challenges presented by COVID-19. We'll continue to engage with NHS boards across Scotland on their needs to support this vital research and ensure that patients have access to high-quality research within the NHS right across Scotland.
Thank you very much, Gregor. I'm now going to move straight to questions. First of all, David Cowan from BBC Scotland.
Thanks, First Minister. Can I ask, is there anything at all in these figures to provide any indication on when the deaths might start to fall in Scotland? And given that a third of the deaths which have been announced today took place in care homes, a sector which would have been recognised as being vulnerable, does that figure show that you were too slow to respond to that threat?
I'll hand over to Gregor also on this question, but on the question of when we would expect to see deaths reduce, I would hope that is very soon. But as you will have heard me say from the podium here before, the way an illness progresses, the deaths will be the last thing we see reduce, unfortunately. So we will see hospital admissions reduce, which we think, now doing, although it fluctuates on a daily basis. We are certainly on the evidence of the last week or so, seeing admissions to intensive care reducing, which would be the next thing you would see reduce. And deaths, hopefully, will follow from that. But there will be a lag, potentially, of several days before we see that really being evident, which is why I know that talking about progress while we're still reporting figures like this is a difficult thing to do, but please understand when you're watching this and listening to this that the signs of that progress are there, but they're only there because of what we're all doing to comply with the restrictions. Look, we will always learn lessons, and in the fullness of time, everybody will be looking back to see on a whole range of things, could we have done things differently or better? But I don't accept we were slow to understand the risk in care homes or to act. We have been taking actions around care homes since the start of this epidemic. The guidance I referred to today about what care home providers should be doing in terms of isolation and social distancing, that was issued some time back. But we continue to learn, we continue to look at what more we can do. The steps that the Health Secretary announced yesterday and I've repeated today are an important part of that process. And the central point I want to reiterate here today is, unfortunately, in any year, a significant proportion of all deaths that are registered will be people in care homes because of the nature of the people who are in care homes, frail, elderly people, often nearing the end of their lives. But that doesn't mean we accept the inevitability of this, or that we don't do everything we can to prevent cases, prevent outbreaks and prevent deaths. And that's why the action we're taking here today and will continue to take will be exploring every way in which we can do that. Do you want to say a bit more about when we might perhaps see deaths also reducing?
So we know a lot more about the nature of the path of this disease now, and the sequence that people tend to go through as they have that illness, and some will become more severely affected by that. And the consequences of that are that they're actually one of the last measures that we start to see being impacted by the type of restrictions that we've put in place will be the number of deaths that we report on each day. As we start to see both the case numbers, the hospital admissions and indeed the ICU admissions begin to fall sequentially, some probably 2 weeks later we'll begin to see those deaths beginning to kind of fall as well. And I'm confident from the figures that we're seeing elsewhere that if we continue with the resolve that we're demonstrating just now, that we're making sure that these restrictions continue to be complied with the way that people across the country are currently doing, is that we'll see the fall in those deaths starting to come through over the coming days and weeks.
Just finally on this, which is a point I've made, but it's a point that bears repetition. The progress is definitely there, but it is also fragile at this stage. So any easing up, if any of us take from this, well, we can afford to maybe go out and see people we've not seen for the last few weeks, that will very quickly send all of this into reverse. So it is just as important, if not more important right now, that we stick to what we're all being asked to do so that we see this progress continue, because we will need to see it sustained, and I'll say more about this tomorrow, but we will need to see that progress and those reductions sustained before we can even think about what comes next in trying to restore some degree of normality to our lives. Ross Govens from STV.
Yes, First Minister, last week you promised to increase testing in care homes. Can you tell us how many more people have been tested this week compared to last? And when you sadly look at the death rates in care homes, is this new testing regime too little, too late?
On the numbers of people in care homes being tested, that is information we will be able to give. I can't give it right now. As you will have heard today, there's lots of things we're trying to give information on, but as you've heard me say previously, we need to get to a point where that information has been robustly gathered and is accurate and reliable. So we are progressively trying to provide more information almost with every week that passes right now, and much of what we are providing today, both what I've already provided and later on, is a continued step forward in terms of the quality and the quantity of information we're providing. I think we are providing more information in Scotland than any other country across the UK, and certainly more up-to-date information. The NRS report that shows total numbers of deaths is a week more up to date than the equivalent figures in England. So we are really working hard to give as much information as possible. I can tell you that yesterday we carried out around 2,000 tests overall, which is an increase on the last few days, and we are continuing both to build our capacity of testing, but also the tests that we're actually carrying out, and we're getting to a stage where we're also looking at how we build a bridge from here, the purposes of testing right now, into what will be a much more mass test operation when we go into the next phase of controlling and suppressing this virus. On the second part of your question, no, I don't think that, because we stressed last week and we stress again today that the extension of testing in care homes is as much as anything to provide greater assurance and certainty to residents and their families of whether or not they've had this virus. The point that we are stressing is that testing, whether it's of symptomatic patients in care homes or patients, residents being admitted or readmitted from hospital to care homes, does not change the clinical management of those residents. Because whether a resident has been tested at all, tested positive or tested negative, the guidance in place right now for care home providers is to ensure appropriate isolation and social distancing within the care homes. And that remains the most important thing, and that remains what it is the obligation of care home providers to implement, and of course the care inspectorate now with the clinical leadership of public health directors to ensure is being implemented. Next I've got Hamish Penman from Original FM.
Thank you, First Minister. I was wondering what discussions the Scottish Government has had in the last 24 hours with oil and gas representatives about a possible sector support deal, and also could the low oil price affect Scotland's net zero ambitions, which relies so heavily on a healthy North Sea industry?
On the first part of your questions, we have ongoing discussions with oil and gas and with others. We can certainly come back and detail the timeline of that, but these discussions are ongoing with every sector of the economy right now, led by the Economy Secretary, the Rural Economy Secretary where that's appropriate, and the Finance Secretary. overall making sure that we are taking the right decisions about financial interventions, and that will continue. Some of that, of course, involves discussions with the UK government as well, because certainly in general terms, but particularly in the case of oil and gas, they hold many of the levers around this. In terms of our net zero position, we have a net zero ambition that is enshrined in law. Clearly, right now, our focus is very much on dealing with the crisis in front of us, but the climate emergency hasn't gone away and will be part of what we need to have very much at the forefront of our thinking as we go into a recovery phase of this. But that has always been about a balanced transition and a just and fair transition that helps people transition into new areas if there is decreasing activity in other areas. So that the justice of that transition will continue to be very much at the heart of what we do and say and think about these matters. Next, I've got Alan Zazinski from Global Radio.
Thank you, First Minister. Looking at that NRS data out today, we've also seen Imperial College research. It finds guidance for people aged 70 and over to reduce their social contact is leaving people in their 60s at increased risk from the virus in terms of they should actually be following the same advice as is the case in other countries. So given you say social distancing will need to continue for at least another 2 or 3 weeks, could we see over 60s moved into that higher category? And just also, as the Scottish Government gets a clearer look at broken down data like that from the NRS of who is sadly passing away and where, are there any other newly identified vulnerable groups that could be moved into these categories?
I'll hand over to Gregor Smith, but can I just remind people that we have a shielded category, which is a category of people that, because of particular and often very rare health conditions, chief medical officers have decided should be particularly shielded, which means total isolation. Beyond that, everybody has been told to stay at home unless it's essential, and not to gather or mix with people in other households. And that advice is there for people of all age groups. And I want to stress that right now, that if you're not in the shielded group, you still have to comply with the general rules on social distancing and staying at home. Of course, we continue to keep all of this under review. This virus is still, 120 days old. There is still much about this virus we don't yet know or understand. I just yesterday was reading a report, and I don't know whether this will be found to be accurate or well-founded or not, that said that researchers in China think there's already different strains of this virus, that it has already mutated more than we might have thought, and that there may be different strains operating in different parts of the world that might, for example, explain some of the differences in impact in different parts of the world. Now, I don't say that because I know for certain that that is true. There's a lot we need to learn. The point I'm making is that one. There's still so much we are learning about this virus, and as we do, we will of course need to consider whether that has an impact and to what extent that has an impact on the advice that we're giving people and the steps that we might need to take in future. Gregor.
So I think we know from all the data that's available just now that it certainly has a disproportionate effect on people who are in that much older age range. But again, I would want to emphasise we should not be complacent about this virus across any age range, and that's why those measures that are in place just now to make sure that we're all undertaking adequate social distancing, being very, very careful with the hand hygiene and all the other measures we've spoken about at length to make sure that we're reducing our possibility of both contracting this virus ourselves but also transmitting it to others. So I think no matter what age that you're in, those social distancing measures, those hygiene measures remain the absolutely critical thing. And of course, we're reviewing the evidence constantly, and even today that there are further meetings to make sure that those groups that we've identified who should be particularly taking an extra degree of caution in terms of their approach to social distancing or even shielding are kept as up to date as possible with the latest evidence as we constantly learn about this virus, and as new decisions are made about that, we'll constantly update the population.
Thank you. Fiona Walker from BBC Radio Scotland.
Hello, First Minister. We have seen a worrying number of what they call excess deaths, those who higher than what we would expect this time of year, but not directly related to COVID-19. Yet at the same time, we're hearing about nurses who in some parts of hospitals are seeing not a single patient. Have we cancelled too many procedures in other parts of the NHS which are having a knock-on effect to people's health?
Obviously, we made specific reference. I made specific reference earlier, and as you rightly say, it's covered in some detail in the NRS report today about excess deaths. Now, it's important to say that in this week's report, about 2/3 of that is attributable to COVID-19. So there's about 200 deaths where that cannot be said to be the case, and some further explanation, not complete explanation, but some further explanation has been given by NRS. But we need to do further work to understand that before we can draw definite conclusions about it. Now, you know, in terms, Gregor will want to say a bit more about that, but in terms of the question, I suppose, about the decisions we've taken, it's always going to be really easy. I got asked a question at the briefing the other day, you know, if we never use the Louisa Jordan, will I regret spending all the money to construct it? The answer to that is no, because I'd rather be in the position of having done too much to deal with this virus than not having done enough to deal with it. And the same is true there. We had to take decisions to ensure that our NHS could cope. Because of those decisions, and actually because of what everybody at home is doing to stay at home, our NHS is not being overwhelmed by the virus at this stage. We can't be complacent. But if we hadn't taken those decisions and were in a different position, this is no disrespect to you, journalists would be saying, why did you not do more? So, you know, we will all learn from these decisions, but I would rather we were being precautionary and taking the action to allow us to cope. Now, a key part of our thinking as we move forward will be how we can restart some of the things that have had to be postponed in the health service, and a key message right now, even with all that change to how the health service is operating, is that it remains open. So if you have symptoms that you're worrying about right now, you must and should get help for them through your GP or NHS 24 out of hours, or where appropriate, accident and emergency. The NHS is not closed if there's something you're worried about. Gregor, do you want to say any more? And
I think it's important not to confuse two different types of treatment here just now. Those that are scheduled and routine, and which are still important, with those that are perhaps urgent or life-threatening. And I would emphasise once again that the NHS remains completely open for people who have urgent and life-threatening illness, and people should continue to present with those symptoms through the kind of recognised routes, either to the GP, or if it's an emergency, through, you know, attending the emergency department, or phoning 999 for really urgent life-threatening problems as well. That hasn't changed at all. What's in the background is that scheduled routine care has been reduced quite rightly, because at the basis of those decisions is where does the greatest risk lie? Is it more risky to continue with that treatment at this point in time, or do we reduce the risk to people by making sure that we pause that and make sure that the NHS is reconfigured to be able to meet the demands that are placed upon it by COVID-19?
Thanks. Peter McMahon from ITV Border.
Thank you, First Minister. First Minister, I think everyone would accept that the staff in their care homes are doing absolutely everything they possibly can to look after those in their care. But if you are a relative of someone who is in one of these care homes and you're looking at these figures, would you not be thinking to yourself, should I be getting my loved one out of this care home because they're in danger? And what would your advice to someone thinking that be?
I think the most difficult thing for all of us, myself included, in looking at these figures and, you know, comprehending these figures and discussing them, is we can all imagine ourselves in this position. Many people watching do have relatives in care homes, but all of us, many of us will have had in the past, and all of us potentially will have in the future. It's an aspect of this. All of this feels very real and raw and personal, but I think this aspect in particular for many of us does. And that's why I want to be doing everything we can as government, working with the experts on the front line, working with care home providers. And what I would say to relatives is that they should be discussing any concerns they have direct with their care home provider, and making sure that we are taking the action in a joined up, holistic way that is about preventing as far as possible this virus getting into care homes. And then, because when it does, unfortunately, we see the danger that it poses. So there is nothing inevitable about any of this in terms of how we see it, and we must continue to take the action. And that's the assurance I give to everybody watching and others who have relatives in care homes right now. I'll maybe hand to the Health Secretary right now, who covered much of what I've said today in Parliament yesterday, to give a bit more detail of the specific steps we're taking to try to enhance the level of protection that is there.
So I'll start with what the First Minister just said about preventing the virus entering the care home. The other important aspect is if the virus does enter the care home, preventing spread. And that is why the guidance that we've referred to that was issued in March is so critical. That is the guidance that aims to prevent spread inside the care home. It's harsh guidance because it says, in effect, no communal activity at all. No communal dining, no communal socialising, and residents in a care home are in effect looked after in their own individual rooms. In addition to that, the other steps that we've taken to increase, on top of what providers are providing, the provision of PPE has been in place for some time. We have improved the ordering and the distribution of that, and we took over the weekend a further step, which was the direct delivery of PPE to care homes, whilst we work with them to understand their current stock levels and what more they might need for us. But the absolutely additional critical area that we've introduced, care homes and their primary care providers, their local GPs, have had good relationships. But now we are enhancing that clinical input using the primary care teams, but led by our directors of public health, to ensure that our care homes have all the clinical input that they need, that staff in care homes do feel that they have the training to use PPE that is as up to date as possible, that they do feel confident about infection prevention and control, and that where through the additional testing work, making sure that social care workers can be tested, that they're given the priority that they should have as a Category 1 key worker, that where that produces resilience issues in the workforce, then we make use of that over 20,000 NHS returnees, students, many of whom have social care experience, to help them be redeployed in order to give more resilience to the social care workforce in and around our care homes. All of that is about enhancing what was there as part of what a care home provider is required to do in order to meet the requirements of the Care Inspectorate. And the final area of assurance is the Care Inspectorate's role. So not only will we be receiving regular reports from those directors of public health, taking additional measures where there are gaps that we need to do more, but the Care Inspectorate will be conducting inspections of care homes in order to provide additional support and assurance to the staff, to the residents, but importantly to the families.
Thanks. Now, I need to try and speed up a bit because we've got a lot of questions still to get through, but one final point on this, just again to give a little bit of context and I suppose a bit more understanding of where our focus needs to be. I gave a figure earlier on of 384 care homes that have a current outbreak of the virus right now. Now, I should stress, in some of those care homes that may only be one resident that is displaying symptoms or has over the past 14 days. And in those care homes, the focus is on making sure that spread within those care homes is minimised as far as possible. But that's 35% of our care homes have some cases right now. That means 65% don't have any current cases of this virus, and therefore the focus has to be on preventing, as far as it is possible to do, the virus getting into as many of these care homes as possible. And that's why this clinical leadership of public health directors, the rapid action team that we've spoken about, the different steps that we are taking are so important. And I want to give people an absolute assurance that these are matters that are taken with the greatest of seriousness, and that people on the front line are working hard each and every day to make sure are given the attention they need to have. Can I move now to Craig Payton from PA?
Thank you, First Minister. This morning, Jackson Carlaw called for the implementation of mobile testing. He said it would work better to cover the geographical spread in Scotland. Is this something that the government is looking into or is considering looking into at any point in the future? Also, would yourself or the Health Secretary or the interim CMO be able to tell us how many people have been tested at all the testing hubs that have been set up across Scotland? Or would you be able to get information to us at some point in the future?
Are you talking about the drive-through hubs?
Yes.
Okay. So on the point, Jackson Carlo, I may be misquoting Jackson Carlo here, so forgive me if I am, but how it's been reported to me is he said that if somebody in Dumfries and Galloway needs tested, it's not convenient for them to go to the drive-through in Glasgow. I agree with that, and they wouldn't go to the drive-through in Glasgow. They would be tested in Dumfries and Galloway by the local health board there. The numbers we are publishing right now for key workers who have been tested, let me be clear, these are numbers of workers who've been tested by their local health board, not people that have had to go to the drive-through centres. So let me be very clear about that, and we're seeking to explore all ways in which we can make that more convenient for people. But somebody in Dumfries and Galloway would be tested by their local health board. If they were a healthcare worker, they wouldn't routinely be sent to Glasgow Airport to go to a drive-through. These drive-through centres are part of a UK-wide scheme. In terms of the numbers, we have been getting, we can provide the specific number later. I think it may be around, but don't take this as precise because I'm doing this from memory. It may be around 1,000, but we don't yet have that data in a way that we can include it in our daily numbers. We're trying to get that, and hopefully we'll have that soon. So we get the total number that have gone through the drive-through centres provided. I think this information goes from the drive-through centres to Deloitte's to the UK government, and then we get a global number, but we don't yet get the breakdown of those who've tested positive and those who've tested negative. So we are trying to get that data in greater detail, and hopefully in the fullness of time we can incorporate that into the figures we publish on a daily basis. But the figures we are publishing on a daily basis right now don't include that. They are only the figures from NHS labs that are doing testing through the NHS. So I hope that's helpful, but if we can provide more information, we'll certainly do that. Simon Johnson from The Telegraph.
Hi, I just wanted to go back to the excess deaths again, if possible. According to the report out today, there's been 270 excess deaths over the past 3 weeks for people suffering from dementia or Alzheimer's. And I appreciate you say you've got to look into this further. But I just wanted to ask the Chief Medical Officer if it was the case, for example, that the people who usually care for the dementia and Alzheimer's patients are either off with the illness themselves or looking after COVID patients, whether you have any anecdotal evidence for why this might be.
I suspect Gregor might not want to give anecdotal evidence on these really important matters in all seriousness, but I will hand over to him to see what further light he can shed on any of this.
So I think it's important that we don't begin any kind of speculation based on anecdote around about any of these figures at all. And there's a recognised process that is put in place to try to better understand these deaths over the fullness of time, whether they be from Alzheimer's and dementia, whether they be from cardiovascular disease, whether they be from cancer, to try and to break down those figures a little bit better, just to see exactly what we can really understand from those figures. So I don't think I would want to be drawn any further on or speculate as to why those deaths may or may not have occurred.
Vivian Aitken from the Daily Record.
Good afternoon, First Minister. Yesterday, the Scottish Government bowed to pressure and announced there would be testing of all new residents in care homes. And today, we've heard you say that you would rather do too much than not enough. Is it not now time, therefore, for the government to similarly readjust its stance on the testing of all symptomatic people and not just as a future exit strategy plan, as the World Health Organization have been imploring countries to do?
I think you've got to be careful, and I won't go into this in detail to sort of quote the World Health Organization. I mean, the World Health Organization gives advice for countries in a whole load of different situations and scenarios. The testing strategy we have pursued so far is based on the three objectives I've spoken about previously: seriously ill people in hospital, key workers, and surveillance testing. We have already expanded that. Care homes being an obvious example. I wouldn't describe it as bowing to pressure. I would describe it as listening carefully, learning as we go, and as we build capacity, looking at where we can expand testing. But on care homes in particular, let me stress a point we've made before. It doesn't change the clinical management. It's about assurance, not about changing how we are asking care homes to deal with the virus or how we care for people. And I think that's an important point. In terms of everybody who's symptomatic, we are asking to stay at home. So again, testing everybody who's symptomatic right now would not change what we're asking people to do. We're asking people to isolate in order to make sure that they're not passing their symptoms on through the virus to anybody else. And we are still in the process, of course, of building the capacity of our testing, because we know we will need to move to a stage, and again, we'll see a little bit more about this tomorrow in broad, in principle terms. We will need to move to a stage when we've suppressed this virus sufficiently, when we're confident we've suppressed it sufficiently, to keep it suppressed. Amongst other things we will continue to have to do, like social distancing, we will have to move to a system of testing people who at that much lower level are symptomatic, and then contact tracing. So that is the right thing to be planning for, but I think it's also right now that we're using the testing capacity that we have as it builds up in the very strategic way we're using it at the moment. Tom Peterkin from the P&J.
Good afternoon, First Minister. Scottish Care are still concerned about PPE. They've suggested that some carers say are concerned it's not being changed often enough. Some carers supporting people at home feel unfairly exposed because they have different PPE to others performing the same task. And they are complaining that as yet there's no explanation on how care homes will be reimbursed for PPE costs, which is obviously an important consideration given some of the tight margins there.
My apologies. I'm going to pass to the Health Secretary, who has regular conversations with Scottish Care. Can I say, just very briefly, the principal responsibility, particularly when we're dealing with private sector care homes, is for the providers of those care homes to be ensuring that their staff are protected. That's not just true right now, it's particularly important right now, but that is true all of the time. The Scottish Government is providing effectively top-up supplies of PPE through our procurement to care homes, but care homes have a duty on an ongoing basis to make sure they've got the right equipment for the staff that they employ. And I think it's really important that we remember that, but it is also important that we take our responsibility seriously to make sure that any top-ups that are needed in the current situation are provided, and that's why we have changed our distribution and most recently added a new route of distribution, which is direct supplies to care homes. And we've still, of course, and we will always have that email address if staff members want to contact us directly because their concerns are not being addressed at local level. Jeane.
Thank you. So I'm actually speaking to Donald McCaskill later on this afternoon. I do every single week, at least once a week, in order to ensure that the concerns and issues that he might have to raise, I'm aware of those, and where we can act on them, we do. That responsibility in terms of the provider and care homes also applies to the providers of care at home, many of whom are also private companies contracted by local authorities to provide that service. Some care at home is provided directly by local authorities themselves. And both local authorities and those whom they contract have that responsibility to ensure the safety and well-being of their staff and that their staff have what they need to do the job. So our role there is as it is with care homes, and that is to take on that additional responsibility, as we have done for many weeks now, to provide additional PPE in recognition of additional pressures and demands on those individual private or local authority providers. We have the direct route for ordering, in addition now to the direct delivery to care homes. We've had for some weeks now the local hubs where we send PPE often in advance of demand to ensure that stocks are there, where care at home providers can secure the additional PPE that they need, be they a local authority or be they that private company. I'm always open and welcoming to hear of any issues that Donald raises with me. We'll see what he raises with me this afternoon. Certainly his cooperation and support, particularly around that package I outlined a minute ago about that additional clinical leadership that we talked about around care homes, has been very welcome. And if there are other issues he wants me to address, then I'll hear about those later.
Okay, thank you. Chris Musson from The Sun.
First Minister, with one in three deaths now in care homes, surely you must now regret not testing all hospital patients discharged to care homes in recent weeks, and indeed allowing COVID-19 positive patients to be placed in care homes. I mean, this now it looks reckless, doesn't it?
No, it doesn't, which is not to say for a single second that I don't regret every single loss of life from this virus, but we have to take steps that are properly advised and informed. We adapt that as we go where we think that is appropriate, and we've taken several decisions that demonstrate that. But there are a couple of things that we can't simply lose sight of in terms of the use of testing. The first is that while evidence is I understand developing that some older people can shed virus in a pre-symptomatic stage. This test is not reliable before people have symptoms. It is the first point. So while testing is important, we can never allow it to be seen as a panacea in all circumstances. It is the infection prevention and control that is the most important thing, and that's what we've got to continue to stress. So whatever testing and whatever extent and targeting of testing is being done at any time in the past, now and in the future, it doesn't change how we are advising care homes to deal with the residents and to deal with infection prevention and control. So it's really important that we continue to understand that, because as we do expand testing, if we ever allow ourselves, and if care homes allow themselves to think, well, somebody has tested negative on one day coming from a hospital into a care home, therefore we don't have to apply any of the other procedures, that's when it will get very dangerous to do. So we've got to make sure we see testing as part of that overall approach, and that is what we have tried to do all along and is what we will continue to do. Seth Carell from The Guardian.
Jeane Freeman for her response to Peter McMahon's question earlier on. But can I just go back onto this question about the number of deaths at care homes? The NRS data last week showed that there was 25% of all deaths in Scotland came from coronavirus. This week it's 33%, which means that between last week and this week, an increasing number of people have died in care homes. Now, much of what you said about the new measures, Health Secretary, to do with care homes, about self-isolation, lockdown and shielding measures that most people are already taking. The staff in these care homes are not nurses. They don't have, presumably, oxygen supplies. They won't have respirators, and they probably won't have the correct drugs to help people relieve the symptoms of a COVID-19 infection. What are you actually doing to put expert medical care, intensive care support, or critical care nurses into care homes in a real life, hour-by-hour situation?
Jeane, I'll let you.
So the first thing I have to say, Seb, is forgive me if I wasn't clear enough, but actually some of the measures I talked about are not new. They have been the guidance, a very, very clear guidance to care homes since early March about the ending of communal activities, about residents being looked after individually in their own rooms. That was really important guidance. It remains really important guidance because it's one of the critical ways by which we prevent, if it's applied and followed, we prevent the transmission of the virus from one individual to another. It is also not quite correct to say that there is no nursing provision in care homes. Many of our care homes do employ nurses, and in all of our care homes, they will have a direct connection with the primary care team, which of course will include district nurses, local GPs, advanced nurse practitioners, pharmacy and others. So that clinical support and advice and engagement has always been there. Many residents, if not all of them, will be GP patients, and GPs have a long and active role in our care homes. What we've done now additionally is to give significant clinical leadership to that work alongside all the other measures that should have been in place, have been advised to be in place for some time. Remembering that to be a registered care home, there are certain standards that you have to meet that the Care Inspectorate sets. Part of those standards is ensuring that all your staff are trained and confident in basic infection prevention and control. What we're now doing is ensuring that given the level of additional anxiety, that we offer additional support to those staff, many of whom have had a very difficult experience as the residents that they care for have died. That is hard for them as it would be for anyone else. So it's that additional support on top of what has been there, should be there in normal course, has been there in terms of our guidance since early March and the supports that we put in place from then on. Now further additional clear clinical guidance and leadership around every single care home from that National Director of Public Health.
Okay, thank you. Mark McLaughlin from The Times.
Hello there. Back to the care home figures. Now, this time last week, there was 25% of deaths in care homes, a third this week, as has already been said. ONS said there's only been 10% of deaths in care homes in England and Wales. So does that mean that Scottish care homes are uniquely dangerous, or is there some disparity in the figures? And if you're following a Four Nations action plan, why can't you have comparable figures to give us confidence that you know what you're doing? And we also spoke to Donald McCaskill about this at Scottish Care, and he said he's heard from several families who say that the COVID deaths have been overcounted, that you may have someone who's had several bouts of pneumonia and the final fatal one has just been chalked down to COVID. Is there a suspicion that the number is being overcounted to maybe cover up for some of the other failings in the NHS that are being left by the wayside?
I don't think there's any evidence of that. I mean, Gregor can maybe, I'm conscious we've got a lot of questions still to get through. I'm particularly taking a long time with my answers today, but Gregor can maybe say a bit about the checking process around death registrations in a moment. Can I say that there is no evidence of that, but obviously the checking process is part of the assurance that is put in place. In terms of figures in Scotland versus figures elsewhere, I think statisticians would be better placed than I am to talk about the consistency or the differences between these figures. I'm not able to talk about the ONS figures for England and Wales, apart from to point out that they are a week behind Scotland. So Scotland's, the ones we've reported today, are a week more up to date. That may in part explain a differential. And I know, and I have no way of knowing the extent to which this is fair, unfair, true, untrue, but I've read accounts of concerns about under-reporting in England around non-confirmed cases. So all I can do is speak for the NRS figures as they are presented to me, that I am as confident as I can be that that is giving us a comprehensive and as accurate as possible a figure for the number of people dying from COVID in Scotland. And I think you would have to ask others about figures for other parts of the UK. But it is not the case that care homes, in my view, are more, to use your term, this is not my term, dangerous in Scotland than elsewhere in the UK. I suspect the questions perhaps are more legitimately posed about the figures and the time lags and other issues around the figures. Gregor, do you want to say any more? Yeah,
I mean, I guess my view is that the figures that NRS have reported today probably give a fairly accurate representation, particularly when you take into account the way that they report on the excess deaths and that total number of deaths as well. We've got a system in Scotland whereby each one of those deaths that is notified to the Registrar's Office is then randomly assigned to a kind of verification process, and if you like, there are safeguards within that system so that any of the kind of patient records are reviewed, a proportion of those patient records are reviewed, so that the accuracy of that reporting is something which can be verified. Now that goes on all year round, and as I say, over time we'll be able to ensure that the reporting process as it applies to COVID or suspected COVID disease, whether it be from care homes or community or whatever, will be subject to that same verification process.
Muir Dickey from the Financial Times.
Thank you, First Minister. I just wanted to follow up on the question about mortality in care homes, because if the figure to date is 33% of COVID-19 related deaths are in care homes, then that would suggest to me, if my arithmetic's not wrong, that for the last week, the actual rate is well over 40%. So the question is, what do you think, what are you being told are the reasons for such a substantial increase in the proportion of deaths in care homes from previous weeks?
Well, obviously, these are things that we are still looking at, exploring, understanding as we go through this. We know the susceptibility of older people to becoming ill or dying from this virus, and we know that the virus, and this is true of care homes, but it's also true potentially of hospitals, spreads more easily within institutions, which is why there needs to be particular measures to slow that down. We also don't know yet, but are looking at, as we think community transmission is slowing down, we still have higher rates of transmission in places like care homes. So these are all things that on an ongoing basis we are seeking to understand so that we can learn and adapt our response as we go forward. And the final point I would make, which is one I wouldn't want to get into too much detail because I don't have all of the detail, but I have read in the last number of days some emerging evidence from other parts of the world that would suggest, I saw some of this reported I think last week, and I think it was in The Guardian, correct me if I'm wrong about that, that globally, or at least in some other countries, it could be, or it is indicated that perhaps around 40 to 50% of deaths overall are in care homes. So I can't say this for certain yet, but I think it is likely that what we are seeing here in Scotland is potentially going to turn out to be in line with the experience of other countries. But of course, we will continue to pay very close attention to that as we continue to take steps to prevent infection, but also learn and understand more about how this virus spreads. Tom Martin from The Express.
Hi, good afternoon, First Minister. You'll probably be aware of the temporary 20% pay cut that New Zealand's Prime Minister, her ministers and senior public sector executives have taken in solidarity with those struggling financially. Are you considering following suit, and do you think other administrations in the UK should be looking at this?
So I already take a pay cut and have done throughout my time as First Minister. Ministerial salaries in Scotland are frozen at 2008 levels. That's a decision we took back during the financial crash and have never undone that. So I don't take my full salary anyway, and every month there will be hundreds of pounds from my salary go directly into public funds. So in a sense, we're already doing what, to their great credit, the New Zealand government has recently announced. Beyond that, of course, we will always continue, and I will continue to consider how we demonstrate solidarity and how we show in big ways and in small ways that we are all in this together. But on the ministerial pay, and I believe Scotland is different to other governments in the UK in this respect, that pay cut has been there for some time already. Tom Gordon from the Herald.
Hello there, First Minister. Just this issue of the care homes. When you crunch the numbers from the NRS, the number of deaths in care homes are actually worse than you might expect. Although it's been a third of deaths to date, in the last week, the number of deaths in care homes was almost the same as the number of deaths in hospital. It was almost 1-to-1. It's 44% of all COVID deaths were in care homes, 45% were in hospital. And that proportion of deaths in care homes has been steadily increasing week on week. Given that is a worrying phenomenon, do you think care homes are being too slow perhaps to refer people to hospital where they could get, a far more intensive level of care?
So I don't know if you heard it, Tom, but that specific, precise question was asked, I think, by Muir Dickey just a couple of questions ago. No, I'm going to answer it. Don't worry, I'm going to answer it. What I was going to say is I don't know whether you heard, because I don't want to just duplicate the same answer. I'll come on to your last point, which I think is a really important point. But this point about it perhaps being a rising proportion week on week in care homes is the point that was made, I think, by Muir just a couple of questions ago. You said higher than we would expect. I would caution against that because this is a new virus, and I don't think it is safe to say that there were any set expectations about what we might see from this. But we do know the susceptibility of older people and institutions, so therefore that means we have to take particular measures around care homes, and I think that is very important. The point you made that is, I think, a really important point, and one that I want to stress, because there has been concern raised that older people who need hospital treatment for coronavirus will not be getting that treatment, that decisions on a blanket basis have been taken just to keep them in care homes. And I want to be clear that is not the case, and nor should that be the case. Decisions should be taken on an individual basis. If somebody in a care home requires hospital treatment, if they require, and it would be appropriate for them to be in intensive care, that's what should happen to them. And it's important that these decisions are taken clinically based, but also on an individual basis, not on a blanket basis, one way or the other. And I really want to stress that. It will often not be appropriate for an older person to go to hospital. It will often, because of what ventilation does to your body, as I understand it, it may often not be appropriate for an older person to be on ventilation in intensive care. But those are clinical decisions, and they should be taken on the basis of what is right for every individual. And I think it's an important point to raise, and it's a very important point for me to take the opportunity to stress. Chris McCall from the Scotsman.
Hi, good afternoon, First Minister. You may be aware of calls from trade unions to hold a minute's silence next week in tribute to NHS staff who have died from coronavirus. The UK government has said it is actively looking at the idea, and in light of data out today suggesting there's been at least 69 deaths amongst NHS staff, can I ask if it's something you would support, and whether you would encourage other Scots to take part in such a silence if it does take place?
Yes, of course. I would want to take part in it and encourage others to take part in it. We're aware of the discussions that are underway, and hopefully we can get to a point where that is something that happens. I think I'm keen to be able to report as we go forward details on numbers of people who have contracted COVID and died from it because they're working on the front line of our health or care system. While in every single one of these is a tragedy, but while, as is the case in Scotland, that figure remains under a certain threshold, there are difficulties in reporting it because of individual confidentiality. We also need to make sure we are gathering that information robustly and not on an anecdotal basis, because I would want to make sure as First Minister that where families were in agreement, we do take the opportunity to pay tribute individually and collectively to those in those circumstances. So we will certainly take part in anything like that, but we will want to think on a longer term basis in due course how we properly pay tribute to those who have done so much to care for all of us during this crisis. Paul Mallock from the Courier.
Good afternoon, First Minister. With the figures that were released by the NRS today, should we be braced for the number of deaths in care homes to go up next week? And on that care home note, are you able to say, or is the Chief Medical Officer able to say, what percentage of those extra deaths, the ones that could be a result of cancer, dementia or Alzheimer's, etc., have taken place in care homes?
I'll hand over to Gregor on that point. I want to answer that question obviously, frankly, but also by making another point really clear. I am not at any point going to accept a certain level of deaths as inevitable. Our priority and our objective in everything we're doing right now is to reduce as far as we can avoidable deaths. People die, and older people, obviously, in care homes, we see people dying out with this crisis period, but we don't accept any level of deaths from coronavirus as inevitable, and I want to stress that point. That said, we are still in the grip of this pandemic, and I certainly couldn't stand here and say that we're not going to see these death numbers increase further. I think, unfortunately, sadly, the expectation is that we will, but saying that does not detract at all from our determination in everything we're doing in care homes and elsewhere to reduce the numbers of deaths as far and as quickly as possible. And out with the care home context, where there are particular issues we've got to address, the indicators around hospital admissions and intensive care admissions suggest that, as I say, out with care homes, we will start to see that number reduce over the next couple of weeks, and that's what we've got to remain focused on. Gregor.
So just to highlight that, I'm afraid I don't have the exact figure of proportion of those patients that have in the excess deaths category that apply to care homes. What I can say is that in general terms, on an annual basis, broadly around about 24% of deaths in Scotland occur in care homes, but as I say, I don't have figures to hand at all which would give you the detail that you're looking for, I'm afraid.
And lastly, Kate Foster from the Daily Mail.
Thanks, First Minister. My question's on the COVID infection rate in Scotland. You've been publishing figures on the number of people who've tested positive for COVID, but what's your current estimate of the number of people in Scotland who are likely to have been infected so far, including those who haven't been tested?
I'm not sure we can say that with certainty. There are a number of studies that you will be reading, as I am just now, that have views on the percentage of not just the Scottish UK population, but populations globally that will have had this virus. I don't think we can say that with any certainty. What we do know, I don't have the run of figures in front of me right now, but of the tests we're doing on a daily basis, the numbers that are testing positive, although this will fluctuate on a day-to-day basis, we have seen, I think, a downward trend in that. But much of what you're asking falls into that category of information that no country has with certainty at this point, and that we're still trying to more fully understand.
We're developing that information from a variety of different sources, and over the fullness of time we'll be able to say much more about it. And First Minister's correct when she says that the general proportion of those testing positive has reduced over the last kind of week to 2 weeks now. As I say, that trend more than individual daily figures is something which is really important for us to take note of. And over time, from other sources of surveillance and being able to kind of monitor various samples of blood that have been taken from different variety of sources, we'll be able to get a clearer sense as to what the kind of point prevalence is for the country in the fullness of time.
Thank you very much. That concludes the questions that we have had notified to us today. Can I again thank you for joining us today? I know, as I've said repeatedly today, the information we're sharing with you is very difficult to report and very difficult to hear. And I don't mean to in any way diminish that by reminding you again that we are also seeing positive signs in the battle against this virus, in percentage testing positive, in case numbers, in hospital and ICU admissions. But that is only happening because you're all doing what we are asking you to do, which is stay at home and follow all of the guidance. I repeat a point I made earlier on. Any easing up at all on that risks sending that progress into reverse. So I know how tough this is, but please stick with it, because it is making a difference. And if we keep sticking with it, we will see all of these figures, I hope, go in a more positive direction in the days and weeks to come. But thank you again for joining us. My thanks to Gregor and to Jeane, and as always to the signers. And we'll be back with you at the same time tomorrow of 12:30. Thank you very much.